Today's topic of discussion is understanding the link between diabetes and GERD. GERD is gastroesophageal reflux disease. So diabetes is a long-term condition where the body doesn't make enough insulin, a hormone that controls blood sugar level, and cannot use it properly. When diabetes is not treated, blood sugar can get it too high, a condition known as hyperglycemia, leading to serious damage over time, especially to the nerves and blood vessels. Patients with diabetes experience digestive issues like acid reflux, trouble swallowing, nausea, vomiting, heartburn, stomach pain, diarrhea, or constipation, and bloating more often than the general population. So, GERD, gastroesophageal reflux disease, is one of the digestive issues which occur when stomach acid and bile flow back into the esophagus, that is the food pipe, irritating the protective line of the esophagus. This condition can damage the esophagus and lead to long-term inflammation, that is known as esophagitis, and also it causes trouble swallowing and an increased risk of esophageal cancer. So while GERD is more common in people who are overweight, it occurs more often in those having diabetes and regardless of their weight. So let's learn what is the link between diabetes and GERD. In people with diabetes, GERD can happen due to many factors including obesity, nerve damage, or it is called as neuropathy, and hormone imbalances. The hormones mostly responsible for the imbalances are ghrelin and motilin. Obesity increases the pressure in the abdomen, which can lead to hiatal hernia, a part of stomach that extends through an opening of the diaphragm into the chest, and weakening of the esophageal muscle and causing acid reflux. Diabetes-related nerve damage also affects movements of the stomach and esophagus, leading to acid reflux. High blood sugar can cause gastroparesis, a condition where your stomach has trouble emptying its contents. So gastroparesis and GERD are closely related in many ways. When the stomach empties slowly due to gastroparesis, food can stay in the stomach longer, increasing the chances of reflux, which can lead to GERD. Diabetic autonomic neuropathy is a condition where diabetes damages the nerves that control important functions like your heartbeat, blood pressure, sweating, digestion, urination, and sexual function. So when the nerves in the stomach and intestines are affected, it can lead to delayed stomach emptying after meals, that is known as gastroparesis. This can cause symptoms like bloating, belching, heartburn, nausea, or vomiting. Specifically in patients with type 2 diabetes, high blood sugar, also known as hyperglycemia, can lead to many changes that affect the digestive system. These include increased stomach acid production, higher level of bile acid, and lower bicarbonate levels. So additionally, people with type 2 diabetes may experience lower emptying of the stomach and esophagus, more frequent relaxation of the lower esophageal sphincter, a muscle at the bottom of your esophagus, and lower pressure in the lower esophageal sphincter during the high blood sugar. So conditions like hiatal hernia and high rates of obesity may also play a role in the development of GERD in people with type 2 diabetes mellitus. So what happens in patients with diabetes, they generally complain कि sir, I'm not able to digest the things properly, because as we have discussed कि on long term it causes nerve damage. Some nerves which are responsible for the early emptying of the gastric content, so they are not able to uh, go into our larger intestine and then defecate out. So what happens ki it remains in your intestine and also GI system for a longer time. So gradually what happens, they feel lack of appetite. So in those cases generally we suggest them some PPI or some enzymatic preparations. So these are the good molecules which can be given, and also along with PPI, some prokinetic drugs can also be given, which helps in gastric emptying. So in diabetes, mostly around 20 to 30% of patients, they suffer from this gastroparesis. And one more good thing is that those who are likely to develop gastroparesis, generally we suggest them to take high fiber diets, so that it will also what happens when the food remains in the intestine for a longer time, the absorption also occurs for a longer duration. So if the patient is taking more of fiber diet, so it will be helpful in controlling the blood sugar as well as in controlling the blood cholesterol level. Thank you.